Hey, good morning, and welcome to the Uropatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our uropatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So today we're going to talk about managing and preventing hot flashes during prostate cancer therapy. I'm going to give some practical tips for patients. Hot flashes, why do they care? What causes these hot flashes? Well, hot flashes are a sudden, intense sensation of heat that can occur without warning, often followed by sweating and even sometimes chills. They are a common side effect in men undergoing hormone therapy for prostate cancer, particularly androgen deprivation therapy, which is the way they reduce testosterone levels. So you may be getting a shot to bring down your testosterone as a treatment. During a hot flash, the body's temperature regulation becomes disrupted, causing the sensation of overheating. Now, these episodes can last from a few seconds to several minutes and may happen at any time of the day or night. While hot flashes are not harmful, they can be uncomfortable and disrupt daily activities such as sleep and overall quality of life. So hot flashes during prostate cancer treatment occur primarily due to hormone therapy, which lowers the testosterone level in the body to slow the cancer's growth. This reduction in testosterone is what disrupts the brain's temperature regulation system, specifically affecting the hypothalamus. That's that little gland that controls the body heat. It's kind of like as if your regulator on your furnace got screwed up, your thermostat. As a result, the body overreacts to a minor change in temperatures, leading to a sudden feeling of intense warmth, sweating, and sometimes chills. Now, these fluctuations are a common side effect of androgen deprivation therapy, and it's a key treatment for prostate cancer. So hot flashes are very common in men that are undergoing this type of prostate cancer treatment, particularly if you're receiving androgen deprivation therapy. That reduces testosterone. It's estimated that up to 70% of men treated with hormone therapy are going to experience hot flashes. And it does vary quite a bit between person to person. Some are really troubled by it. Some only have mild experiences of it. So despite being a common side effects, there are effective strategies and treatments that can help manage the discomfort caused by hot flashes. So lifestyle changes, they can be an effective way to prevent or minimize hot flashes in men undergoing treatment. Regular exercise such as walking, swimming help improve overall health and can reduce the intensity of these hot flashes. Dietary adjustments like focusing on plant-based foods and avoiding triggers such as spicy foods, maybe caffeine and alcohol, can also make a difference. Try to manage stress through relaxation. Techniques like deep breathing, yoga, meditation, they all can help decrease your stress and decrease the hot flashes. Additionally, if you wear light, breathable clothing and keep your environment cool, especially at night, this can reduce the severity of hot flashes. These simple but consistent lifestyle changes can greatly improve comfort during the treatment. Now, for men experiencing bothersome hot flashes during prostate treatment, medications and therapies can offer effective relief. So if this is something that's really bothering you, make sure you mention it, because there are hormonal treatments such as low-dose estrogen or a drug called megestrol, which may be prescribed to regulate the temperature fluctuations. I can tell you that personally, I've seen a lot of big help with some of these drugs on preventing hot flashes, especially in some patients that really, really suffer. Non-hormonal medications like certain antidepressants, such as venlafaxine and other anticonvulsants and such things as gabapentin, have also been found to reduce the frequency and severity of hot flashes. Some men explore herbal supplements such as soy or black cohosh. Heard a lot about that black cohosh from patients, though it's important to consult with the doctor before using these, as they may interact with other cancer therapies. Treatment therapies such as acupuncture have shown some promise in alleviating symptoms in some patients. Always consult your healthcare provider to determine the best approach to tailor your particular needs. Now, tracking hot flashes can be a helpful strategy for men undergoing prostate cancer treatment to better understand their triggers and manage symptoms. By recording a daily record noting the time, the frequency, the duration, and intensity of each hot flash, patients can identify patterns such as certain foods, maybe a stress or an environmental factor that may contribute to these episodes. A hot flash diary can also include information on lifestyles, habits, and things like exercise, sleep quality, medications, which may influence the severity of symptoms. This information can be valuable when discussing your symptoms with your healthcare provider. So a little homework, writing these things down, it makes a big difference. Again, communicate openly with your healthcare team. Nobody's a mind reader. It's crucial for effectively managing your hot flashes and overall health during prostate cancer treatment. Patients should feel empowered to discuss any symptoms they experience, including the frequency and severity of hot flashes, as well as how those episodes are impacting your daily life. This dialogue helps allow us, the healthcare providers, to better understand you, the patient's experience, and tailor treatment plans accordingly. Whether it's adjustments in medications, lifestyle changes, as things that we spoke about, those all can help. Moreover, discussing your concerns can alleviate the anxiety and foster a supportive relationship between you and your healthcare team, ultimately leading to improvement of quality of life. So, knowing when to seek help, additional help for managing your hot flashes is very essential for maintaining good quality of life. Patients should never be concerned about reaching out to their healthcare provider if lifestyle changes and prescribed medications aren't effectively alleviating their symptoms, or if hot flashes become increasingly frequent and intense. Additionally, if hot flashes significantly disrupt daily activities like sleep or emotional well-being, it's important to communicate these concerns to your healthcare team. Persistent symptoms may indicate a need for a revised treatment plan, for further evaluation for other underlying issues. Early intervention can lead to a more effective management strategy and help improve overall comfort during the treatment. So that's really all I have to say about hot flashes. Hope you don't suffer from those. If you do, make sure you mention it, because there are treatment options, and gosh, we want to make you as comfortable as possible. So, hey, tune in next week for more information on the Uropatient podcast.